The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in.
Hi, everyone. Welcome to Birth Baby. Today, we are excited to have Anne Leclercq, a certified midwife in both Europe and the U.S. on. She is also an international board-certified lactation consultant and a natural family planning coach with the Marquette Method. With over 20 years of experience in holistic birth, she has worked in Belgium, France, and the U.S., both in hospital and out of hospital. Anne and her husband moved from France to Austin in 2012. She is also a certified haptotherapist. She received her certification in 2012. Her passion for motherhood and birth drives her to help others experience a calm and stress-free birth. She is dedicated to helping mothers through their breastfeeding journey, helping them overcome challenges, and ensuring they have a positive and successful experience with breastfeeding that is also fulfilling. Currently, she's focused on helping women better understand their bodies and fertility, and wants women to be empowered and be supported in their choices. And thank you so much for coming on today.
Thank you for having me. It's really great to be with you.
Awesome. So I know we're going to be talking about kind of postpartum birth control today. So I'm excited to hear a little bit about this from you. So what are the options for birth control after someone has a baby?
So what are the options? It's really, you can have as a birth control, there is different kind of option. You have the hormonal option, the barrier option, the natural family planning, and the permanent option. So on all of that, almost all can be an option in postpartum, but like the hormonal, we know that with breastfeeding, the hormone are also implies, so you cannot use everything. So it's where the one there is more pro and cons, and it's more not difficult, but you need to make the good choice to use will be the hormonal one, because you can not use everything. So if you want to use the barrier one, you can use all of them. So condom, female condom, male condom, all of that, it's fine to use in postpartum. Permanent one, vasectomy, ligation, that is fine too. For the hormonal one, what you cannot use, it's when you have estrogen in it, because that is going to have an impact on your milk supplies. So like the regular birth control, you take 3 weeks and you stop for 1 week. It's not an option when you are breastfeeding. The NuvaRing, it's also not an option. The good option will be the mini pills, the progestative option. So like the mini pills you are going to take every single day at the same time. You are going to have also the shot, the Depo-Provera shot. The implant, it's a good option too, and the IUD. So IUD, you have the IUD, the hormonal one, and it's progestative so that you can use it. And the IUD, the copper IUD, it can be an option too. But even those options, it's not something you are going to use right away, because if you use progestative hormone right away, it's going to impact your milk supplies. So usually you are going to talk about that with your provider around 6 weeks, and you are going to start between 6 to 8 weeks. Now, the other good option, because I have a lot of mom, and it's for that I started to study the Marquette Method. It's a lot of mom doesn't want to take hormone anymore. So it's for the natural family planning. You can use natural family planning. Now it's what you are using. My big question is to the mom who are telling me, I will do natural family planning. Great. But what did you use before? If someone was using the calendar method, so it's a rhythm method where you look at your regular cycle, it's not an option. It's not an option
Right.
because you have different cycle in postpartum. So you have the first cycle, we call that the cycle 0. It's a cycle from the birth. So you have your bleeding at the birth until your first period. And the cycle 0, we never know how long it's going to be. You have some mom, it's going to be 3 months. Some other mom is going to be 9 months. Some other months is going to be 18 months. So it's where that can start to be more confusing. So with the natural family planning, the calendar method, you cannot use that, definitively not. There is other method where you can look at the body rest temperature, the body basal temperature, BBT, body basal temperature.
Right.
That is also can be confusing in postpartum because you are in lack of sleep. So your temperature is going to vary no matter what, because you are not going to sleep your night like you should when you are doing the basal temperature.
Because that's the one where you wake up in the morning and then you take your temperature like before you even get out of bed. But for like someone with a newborn, you're getting up 5 times a night or something. So your temperature will be like all over the place.
Exactly. But now I have some patients who are telling me they are using also the ring. You have the Oura ring or other rings that can track the temperature. But it's the same. You are in lack of sleep. So your temperature you are not going to have a basal temperature at the same. So it's something you need to pay attention of, because you need to add some other criteria. You cannot only look at your temperature. The other criteria can be to look at your cervical mucus. So the cervical mucus change through the cycle. So it can be when you are not fertile, it's going to be more thick, you are going to have less vaginal discharge. And when you are fertile, it's going to be more stretchy, more clear, more watery. So that is something you can look, but what can be confusing is sometimes it's based on your hormone. So your cervical mucus change with your level of estrogen at first. And when you have the peak of LH, so it's when you are ovulating, it's when it's going to be super watery. And what I am seeing with the mom is usually they are kind of confused because sometimes they can start to having more the stretchy, but they are never going to go to the watery discharge. And that is normal. It's because with the breastfeeding, you can have your hormone. So what is happening, it's with the breastfeeding, you are not going to ovulate at first because your hormone are the prolactin inhibits the ovulation. So you are not going to have your peak of estrogen. And it's where you are not going to start any cycle, because your cycle for ovulation, you start to having a peak of estrogen. And finally, you have a peak of LH. That make you are having, sorry, I'm starting to be confused on how to say it, but you have a peak of LH, and that is when you are ovulating.
Right.
So with the breastfeeding, usually you won't have this estrogen peak at first, and sometimes you will have a little bit of this estrogen peak, but it's going to go down and you don't have this LH. So it's where it's confusing because it's not regular. So with the other technique, it's with checking your hormonal your female hormone, and that is with a urine test you are going to do. So that can be really interesting, and it's with the Marquette Method. It's what we are offering to teach, and that can be really interesting because it's kind of make you also not think about, okay, what do I look for? You just read what is on the stick, and you see if it's you have a high day, a peak day, so that can make much easier to read, especially when you have your breastfeeding brain, where you don't want to think too much. So the only convenience about all this natural family planning, it's really you need to track and you need to be consistent. So the fact that you are consistent and you need to be committed, so it can be exhausting, even for a mom in postpartum. So
Ciarra is here, and I have a terrible voice, but I'm going to ask a question. That's why I've been quiet, everyone. This method, you have to buy these sticks, right? So, or these strips. So does that become pretty expensive, or is it kind of the same as having to pay for birth control?
So that can be expensive. The Marquette Method it's not cheap because you need to buy the clear blue monitor. So that is already around $100. And after the stick are so you need to buy the stick every month. So it's I think it's $30 for 30 stick. So, but you won't use 30 stick a month. When you are on regular cycle, you will be using around 10 stick a month. But yes, so that means it's a budget. So the other option, if you want to do in between, and what I'm seeing with some mom who don't want to spend that money for that, you can use, you look at your cervical mucus, and when you're starting to having so when you're starting to have a clear mucus and you feel that means you produce estrogen, you can buy just the LH stick. That is much cheaper. And the LH, it's when you are going to have the peak and when you are ovulating. So that can help you to have less budget. And but yes, that is part of one thing that it's more expensive.
Yeah. It sounds like it's a lot of similar to what many of us do to get pregnant, but you're doing it kind of just for the opposite of trying not to get pregnant, which makes so much sense. But I've never really thought of it, thought of using those things in that way. I did all of that. I did testing and basal, body temperature and all these different things when we were trying to get pregnant with my son. And I've never thought of doing that for fertility, not trying to get pregnant planning, but that makes a lot of sense.
Yes, it's exactly that. It's the idea is to learn how to recognize your fertile window. So your fertile window you use in one way or in another way to be pregnant or to avoid to be pregnant. It's exactly that. So, but what I didn't talk about, and I have some mom in postpartum, you need also to have in mind that there is a lactation amenorrhea method. So that is when you are breastfeeding and you are not ovulating. So what are the rules for this method? The rules are interesting to know, and it's helped to maybe push back when to start to look at your cycle. It's if you breastfeed every 3 hours, and if you have one time between you have 4 to 5 hours. So if at night you have a break of 5 hours and you are breastfeeding every 3 hours, and after you have your bleeding, so you will have your bleeding postpartum up to 40 days usually. After that, you shouldn't have any bleeding. So if you don't have bleeding, no spotting, and you are breastfeeding every 3 hours, and you are less than 6 months, normally you should be covered by the lactation amenorrhea method, so the LAM method. So that is interesting to know. Now, the mom I am seeing, it's really funny because you have some who are totally fine using the LAM method, and they don't plan to have have sex anyway for a few months. So they are fine. And they said, okay, teach me right now, but I am going to start when I feel. I say, good, we do that. And some, they want to know, even at 6 weeks, they want to be on top of it and say, no, at 6 weeks, I want to know and I want to start, because they just want to be ready. So I think it's really personal about when the mom wants to start. But what I'm seeing for sure, it's when the mom start to having some spotting already. It's when they start to stress out and say, okay, what is happening? Or when the mucus start changing, they say, okay, what do I do now? How do I track and what do I do to make sure I'm not going to be pregnant? Because as a midwife, I always recommend 9 months to be pregnant, 9 months to recover, to at least wait nine months, 9 months to a year before you have another baby, just to help your body to recover a little bit. So, and you have a lot of mom who wants to do that. It's rare that I have a mom who said, no, I want to be pregnant right away as soon as possible. So,
yeah, I think with the breastfeeding method, I was seeing some comments about this the other day on social media about how, I think it was in a nurses group, and they were talking about how so many people are like relying on that method of, oh, I'm breastfeeding, so I can't get pregnant. Like, well, but that's not accurate. So I think it is really important to know, like, you have to meet all of these things. You have to be breastfeeding every 3 hours exclusively, not offering bottles. You have to be, you have to be before 6 months of age. We have to have all of these things. And then you do still kind of have to pay attention. Like, if you're noticing signs that it feels like maybe your ovulation is coming back, then you're probably going to ovulate. Because people, I remember I was shocked when I went to my OB after my first birth, and she was like, you'd be surprised how many people come back to their 6-week visit and they're already pregnant because they didn't think they could get pregnant. So, I think it's important to know, like, you can get pregnant, especially if you are not following all of those things.
Yeah. And even the rules, so you have the rules, but you have some factors that if you are eating, if you are eating well, if there is different factor that can make you ovulate, because yes. And the big things is what moms doesn't realize all the time. It's you are going to ovulate before you are going to have your first period.
Yep.
So it's where it's so confusing. You cannot say, oh, I don't have my period, I'm not ovulating. No, you are going to have your ovulation before this first cycle, this first period. So it's where it's important to know your body, to know what is happening, because it's better for you to understand what is happening. And it's really funny now that I'm doing that. I am always asking, because I'm an IBCLC. I'm always trying to see, okay, when they have their period, what's happened with the breastfeeding, or when they have some day where they have they feel, oh, I think I was going to ovulate and I didn't. So what's happened with the breastfeeding? Did you breastfeeding the same amount? Did baby cluster feed more that day, that week? And yes, we can see that usually there is a little switch that is not that much, but especially when you have the first period, the mom feels the baby's cluster feeding more. So that is my next. I'm going to study that, how that impacts the breastfeeding, because yes, the mom feels the baby needs to cluster feeding when they have their first period, because there is an impact probably on the supplies during that week. So
it makes me so mad. It makes me so mad that we don't learn about this, about our own bodies when we're young. Like, that kids aren't being told this, like teenagers aren't being told this, because how embarrassing to be like a 38-year-old mom going in and having your baby and having no idea how your own body even works. We should know these things.
Yeah.
So ladies, if you're listening, teach your kids,
Yeah. Teenagers are not that easy, because my daughter, I already told her, you need to learn that. I want you to learn that. She said, no, Mom, it's disgusting. So she's going to grow up. She says me that a year or 2 years ago. So I probably in the next couple of years, she will be ready to hear that. But it's funny. It's funny. The teenager age, it's not that easy to learn about your body because
but it's
you have
so interesting. Like, I don't feel like I knew about any of these, like cervical mucus and basal body temperature. I didn't know about any of these things until I was trying to get pregnant. And then it was like, I'm like in this crash course of like, oh my gosh, my body does all of this. And I had no idea. And then after I had my son, I thought I was using natural family planning, but I was using it too late. He was out older than 6 months. And that's why I have a daughter. But
and I've talked to my daughter about this stuff since she was really little because I've been a birth worker, since she was like 7. She's known about all of this stuff. And I have a 14-year-old who's not embarrassed about anything to do with any of that, which is really cool, and it's probably kid dependent, but she's really interested in how her body works. She talks to me about all that stuff. So, if we do start as a norm teaching this younger, then our culture will stop being so like prudish about it because it's literally our bodies. That's it.
Yeah. And that can explain also so much about the change in their behavior too, when the teenagers start to be so upset and you say, okay, where are you on your cycle? What is happening with you today? Because I didn't say anything different than yesterday, and you are so upset for no reasons.
Yeah.
So
it is so interesting.
Yes.
So as far as like birth control, I think you touched on this a little bit, but if someone wants to avoid getting pregnant after having a baby, how soon after I guess how soon after having that baby should they start implementing whatever method that they're wanting?
So usually they are going to talk about that at the 6 weeks visit. They are going to have with their provider, midwife or OBGYN. And the 6 weeks is when it's around the 6 weeks you are going to start. When what I'm seeing for me when I'm working as a midwife, it's at 6 weeks. We talk about it. If they want to take the birth control, we give the prescription. If they want to do something else, like the implant, or it's just we are going to schedule that in the next couple of weeks. So if it's the parents decide to do vasectomy, for example, that is something we are going to discuss about. So for me, it's more about do that now because it's a great period because it's in the first 6 months. But also I have some patients who you need to also wait, and do a feedback follow-up visit after you do the vasectomy because you have 3 months after where you can still have sperm in your fluid, so you can still.
I wasn't supposed to talk, but I'm going to do it. Do you know that when you get a vasectomy, they send you home with something that looks like a pregnancy test to test your own sperm?
What?
Oh, no.
Yeah. So like there's this little thing and they have to take the specimen on their own. They can't have partner participation because it can't be contaminated. So one morning I woke up to a picture because I joke that I sent my husband to the vet when my son was 5 weeks old. So I was like, we're not having any more kids. You go to the vet and you get fixed. So he went and he got his vasectomy at 5 weeks and he took the test whenever they told him to take the test. And he sent a picture to me while I was sleeping one night. And the next morning I woke up and it had a picture of his negative sperm count test. And it said, congratulations, it's never a baby. But yeah, amazing. They give you one to do at home. Actually, they give you 2 to do at home.
Oh, I'm not sure all of them are doing that. Oh, I don't know.
They should. It's really great to be able to do that at home.
Yes.
And also you should go get checked every couple of years because those things are not foolproof.
Yep. Yeah. I've heard of them like revising themselves and people getting like magically pregnant years after vasectomies. So follow up. No method is foolproof. I think we all know that. People get pregnant Those little suckers can kind of ninja their way through anything if they really want to.
Yeah. I remember a patient for her first baby. She came back. She said, "I don't understand. It's a magical baby." But they didn't do the husband didn't do the follow-up test. So
Yep, that'll do it.
so it's for that. I don't think they have the test at home, but maybe they have and he didn't do it. I don't know. So
I know people are going to be listening to this and going on Amazon to see if they can get the sperm test just so they can make sure that their husbands are all still good. Because I
like the sentence on it. You can. So that is funny.
That's awesome. So is there any advice that you'd like to give to anyone listening that's exploring birth control options?
Any advice in which way? What do you mean about advice? What should I think about what the choice is? It's really personal. There is pro and cons for each of them. And it's more about what you feel more comfortable with, what the couple feel more comfortable with, because some people will prefer barrier method like condom, and that is fine, but everyone needs to be on board of that. I think it's really the couple need to discuss about their choice and really discuss about they are all on board with the same decision, because anyway, I think it's a commitment. If you use a barrier method, it's a commitment to use it. If you use the natural family planning, it's the same. It's a commitment and it's a tracking every single day. But if you use the mini pills, it's the same. It's a commitment. It's every day at the same time, So no matter what, you have less commitment if you use an implant or if you use an IUD, because once is in, you don't have to think so much about that. So I think everyone needs to look at what feels better for them and what they feel more confident they are going to use really well, because I don't think there is one better than another one. I think it's what fits you at this moment of your life. That is really, because some of the people will like to use the IUD at this point of their life, and maybe the next pregnancy they will say no more because I don't want to take hormone anymore. So I think it's really looking at all the pro and cons for each of those and what fits you better at this point.
I love that. I think that's really important, is having those conversations early, even before you've ever even had your baby. When you're still pregnant, start discussing like what you're going to do beforehand. That's something that we teach in our Austin birth ed classes. I know Ciarra touches on it in our hypnobirthing classes, and we talk about it with our clients prenatally too. Like, hey, just start thinking about this, noodling on it right now, because you don't want to be at your 6-week appointment and your midwife or your OB is like, okay, so what are we going to do today? You want this IUD, you want this prescription, you want to do this, you want to do that. Is that conversation's going to happen? And having an idea of what you want to do and having that conversation with your partner beforehand, so that you know what your goals are and that you're both on the same page is so important.
Yeah, I think it's really important. And to open the discussion before, it's help you to not rush in one choice that you feel it's not the right choice at the end for you. So
absolutely.
Because as a midwife and OB, it's not going to be a long discussion at the 6 weeks visit. Even the midwife, you have more time, but even if it's more time, it's still not a discussion where you have time to process. You just have your option in front of you. So
exactly. Yeah. And get a little infographic of the options available and make it. And that's about all they've got.
Exactly.
But there are so many different options and so many different, I really think it is an individual choice, like you said, because some people have no issues with hormonal birth control and their bodies react totally fine to it. My body goes completely in revolt when I take hormonal birth control. My body cannot handle it. And so that's not an option for me. So I have to look at other options, and other people, those other options aren't great for them. So
I didn't talk about that, but if you the choice for non-hormonal choice can be also copper IUD. You can have the copper IUD. So that can be also a great option in postpartum that is not going to impact the breastfeeding.
Yeah.
So.
Yeah, but it's not a good option for people who have heavy periods already or
Exactly.
who have like PCOS or endometriosis or some of those things. So then it gets so tricky.
Yes, it's tricky. You have pros and cons on all of them, that for sure. So
absolutely. Yeah. So if people want to learn more from you, how can they find you? And we'll make sure we add this to our show notes as well.
So they can find me, they can send me an email, they can call me or text me. I have a website, so I show usually what I'm doing. It's the consultation. I'm doing a virtual consultation for those consultations. I'm working to do a class in person, but I have my course online too, so they can watch the course online and we can do visit after that. Or we can do a visit first to see what they are looking for exactly. And the in-person class, I'm working on it I know when I will do it. It will be once a month. It's just I don't know where exactly yet. So it's what I'm working on. But the next one should be in November 9th. So that is when I will do my next one. So
I love it. Awesome. And we will make sure we link all of this in the show notes. Anne, thank you so much for coming on and sharing about all of this. I think this is such valuable information for all of our listeners. We talk a lot about birth and babies. I think it's also important to talk about when you don't want to have one.
Yes. But Ciarra, I really think more I am learning about that. I think you're right. I should do a class just for teenagers because
absolutely.
I feel
I would send my kid. She would go. I would take her for sure.
Yeah. So I really need to think about something for teenagers because they would be learning so much about how their body works. So
I would love that.
That would be so cool.
So yes.
Awesome. Well, thank you so much for
You're welcome
on, and we will make sure we link everything in the show notes. Thank you, Anne.
Thank you, ladies. Bye-bye.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.